Hello, good evening. I'm Dr. Alex Brown. I'm a new non-operative physician with Southeast Orthopedics.
Oh, sorry.
I'm board certified by the American Board of Internal Medicine and the National Board of Physicians and Surgeons. I'm in internal medicine and sports medicine physician. I lived in Tennessee for 14 years. So I did medical school at East Tennessee State University. I then moved up to Cincinnati for my residency training. I was at Jewish Hospital of Cincinnati for 3 years. Actually stayed in Cincinnati and did my pediatric sports medicine fellowship at the Cincinnati Children's Hospital there in town. I moved down here right after fellowship and have lived in town for 12 years. I actually I was a primary care physician for about 5 years when I had first moved down here. I then got a job with the University of Florida here in town at Jacksonville with Shands, where I worked in the orthopedic department for a few years as an associate professor. After working there, I started with Ascension at the urgent cares here about 6 years ago when they opened. So I had worked for them for about 6 years in the urgent cares, seeing a little bit of everything that came in the office. And just here about 6 weeks ago, joined Southeast Orthopedics as a non-operative sports medicine physician. I actually am at the new office here in Mandarin, and I treat injuries head to toe. I'm not a surgeon per se, so I don't do surgeries. So I see kind of anybody that would be referred to an orthopedic surgeon for evaluation. I treat pretty much any sports injuries. So, I'll see high school and middle school kids with injuries, see through professional athletes here in town, college athletes. Lots of weekend warriors come in with a variety of injuries. I have seen a few pickleball injuries here lately. So, just my adults doing a variety of activities. Treat sprains and strains, ankle sprains, things like that would come into the office to be evaluated. I do fracture care with casting and braces and things like that. So fractures, can a fracture that would come over to see an orthopedic surgeon, they could end up in my clinic and see me. I also see concussions, again, typically my athletes, but I always tell people kind of anybody can have a concussion from a variety of activities or injuries. Arthritis, lots of arthritis, different places. So see lots of patients with arthritis, do a variety of different injections for arthritis, among other things. I kind of see all ages. So with the pediatric sports medicine fellowship, I'll essentially see kind of kids 8 and up. Again, the younger kids, 8, high school, college kids. So see, all age groups. Let's see. So again, different things. I'll see, pretty much anything in the office. Doing the fracture care, bracing, casting, splinting, that kind of thing. Discussing osteoarthritis. I'll do a variety of types of injections. Steroid injections, which are very common, so do those very commonly in the office. I do the hyaluronic acid injections, the gel injections as well. So those are done in the office, anywhere from 1 to 5 injections, weekly. Have patients come back in to do those, and they can be very effective. So do a lot of those in the office. We do have a physical therapists right next door in the building, in the office. So have a lot of folks do physical therapy. So we have some very good physical therapists next door. I mean, we have our other locations have physical therapy as well. So sometimes, depending on what side of town you live in, we may have you go to one of the different offices to do, physical therapy. Here in the near future, I'll begin doing platelet-rich plasma injections, which is not a new thing. It's been being done for the last few years, but myself and a couple of the other physicians in the practice do these. So I'm getting set up to do those as well here in the near future. Oh, sure. Lots of different injuries. One very common was ankle sprains, and again, high school kids, my adults come in, so that's a very common one that I see. To use a variety of different treatment modalities to get people feeling better and get them recovered from that. Another common one that we see, very common, rotator cuff injuries. Tendinitis, partial or even complete tears in the rotator cuff. So that's another very common one that I have come in and I see in my clinic. Sure, that's another one that I see commonly with the sports injuries. And there's, again, a variety of things that we do. The most effective and biggest help being rest. Typically I have, my kids stay out of school even for a couple days. I like them in school. They need to be in school, but I will have them stay out of school for a couple days or even longer if it takes that long. My adults, usually I'll have them stay out of work or other strenuous activities. And activity as far as sports and exercise as well. So I keep my athletes out of their sport that they're in and have them rest, which is a lot of what gets rid of symptoms. And other things, just different symptoms from headaches to nausea. There's a whole host of a variety of different symptoms that you have with a concussion. So often we're treating particular symptoms, whether that's as simple as Tylenol or Advil for a headache, or other medications, anti-nausea medicines, different things to give patients some symptomatic relief from those from the symptoms they're experiencing with a concussion. So they often resolve fairly quickly, actually, over a week. Usually symptoms are going away, and then usually that's a gradual return to your daily activities or your sports. So I see a lot of those and enjoy taking care of those, folks with concussions. Sure, that's a good question. As I've kind of mentioned, with a variety of injuries, strains and things to arthritis, usually it's a very multifaceted approach, starting from ice and heat to oral medications, whether that be Tylenol, Advil, steroid type medications. Typically, trying things like that first. Myself included, most of us don't like having injections if we can help it. So sometimes I'll say that after we give a few other things a try. Physical therapy is, I send a lot of patients to physical therapy, but it's very effective. I mean, it's effective for a lot of things. So, lots of physical therapy, and then injections are in there when it's time, when it's appropriate. We do injections and continue physical therapy, and with a lot of success and a lot of things that I see in the office, that you would go to an orthopedic clinic for, get better without surgery. So that keeps me very busy, and I can see patients and get them better, and they don't have to have any discussions with the surgeon. Sure, there's not necessarily set in stone things, such as the steroid injections, which we tend to say, we can't have any more. We don't do any more than every 3 months. Whereas you get into some of the gel injections or PRP injections, and we can do those almost in conjunction with steroid injections. We don't have to spread the gel or the PRP injections away from steroid injections. But the PRP, as with the gel injections, take longer to work, so the PRP, usually we tell people, we got to give them some weeks to take effect. And everyone's different, as with many medications or many treatments. A lot of people are different as far as how long it takes, that to kick in, so to speak, and be effective. So on occasion, we may go a couple weeks and say, maybe it hasn't been effective. And, if it's been more than that, it's a 3-month time period, then we may say, okay, even though it's been just a few weeks, then we're okay to try another steroid injection to see if we have effect with that, where, the PRP may not have worked, or the hyaluronic acid gel type injections didn't work either. Sure, that's a tough one. It's one of those injuries that takes a lot longer than we would care to wait. So I think, going back again to my non-surgical things, from medications, the physical therapists do a good job with that. And so often they have some different modalities that they do. There's this A-stem technique and Graston technique, where I kind of liken it to a deep tissue massage, where the idea is to, it's interesting. It's almost like you're causing some damage and some bruising underneath, in the area, of concern. But then the idea is you've got some damage in there, no different if you have, tendonitis or, hamstring tendonitis in their injury, where then you kind of force your body to produce those natural healing factors to try to get it to heal up. Lots of activity modification, as far as trying to avoid activities that affect it negatively, that bother it, and go to other things, other activities, other exercises, that you can still perform without pain, but strengthen everything kind of around it. But it's a common thing we see with, like, sprinters, is a good example. So try to do some different things. That may be an area where we may even consider something like a PRP injection, but it is a tough injury to treat. So we kind of throw a little bit of everything at it to see if we can get it better, and time, like as with a lot of injuries, time, letting that heal, getting that healing time, which everybody likes to get back as soon as possible. And that's part of my job, is getting people healed up and getting people feeling better so they can get back to, whether it be their daily activities or their weekend warrior activities, or my athletes getting back to their particular sport that they need to get back to. Sure. Yeah. So I'm at the Mandarin Crossing location. There, it's down on Old St. Augustine Road, by 295. Our office is open Monday through Friday. I'm there 8 to 5 every day, seeing patients. The office just opened. I'm there and available and ready to get seeing patients.